It's a beautiful day in the gayborhood, a terrifying day in the gayborhood. To ask a gay doc. It's a service of Desert Oasis Healthcare and KGAY 106.5 and 92.1. Dr. Renzo Corzano, my co-host, and we have more than one doc on Ask a Gay Doc. We would like to welcome Dr. Greg Kuldanek, who is the medical director for healthypstest.org. It is your local STI testing and treatment facility here in Palm Springs. And I've got Jeff Taylor, no relation, from the HIV Positive Aging and Research Project known as HARP-PS.org. I've remembered everybody's websites. Welcome, gentlemen.
Thank you, John, for having us.
Why are we here, Dr. Corzano?
We got to talk about something that's very pressing and in everyone's minds right now. It's basically all the recent changes that have been done to places like the CDC and the FDA and funding to a lot of programs that LGBTQ people are dependent on, and all the fears and uncertainty that this has created.
You're hearing fear in your patient community.
I have, and it's not just from my gay patients, it's also from my Hispanic patients who are sometimes worried about certain things. There's a lot of unknown as to what's going to happen in terms of HIV prevention, HIV funding, even like research funding currently, because everything's being cut left and right. And everything I'm reading right now, every article starts with the worst thing, right? We're not being hit by that yet where I work because we basically deal mostly with Medicare Advantage at this point. But you guys are dealing with a very vulnerable population. And I really want to get your perspective on the show so that we can address this for the population in Palm Springs.
Greg, why don't we start with you? And how is this affecting Healthy PS Test? Specifically because you do depend on a lot of grants.
We do indeed, John, and we had hit a little bit of a rough patch this past year where the county stopped one of our major grants prematurely as they were redirecting their focus from just an HIV epidemic to more of a syndemic, bringing in all of the other STIs, which we applaud. Because where you have STIs, you have an increased incidence of HIV disease, and STIs in the HIV positive population, especially if they're not well controlled, are more problematic. But that put us in a tough spot. Fortunately, we do not rely on any direct federal funding. However, there's that trickle down from the state to the county and then to us. We've been blessed to have an outpouring of community support that saw us through that last rough patch. And we've identified other sources of revenue. So I think at least for the short term, PS test is going to be fine. But Dr. Corzano said, Renzo, I get asked by patients all the time, are you going to be able to keep your doors open? We really appreciate your service. Are you going to be here for us in the future? And the short term answer is yes.
Take it over to Jeff Taylor. Jeff, you have actually served on presidential commissions.
I did. It's past tense now. So I was on the President's Advisory Council for HIV/AIDS, called PACHA, and that's a whole department. It's part of lots of acronyms in the federal government. This was the Office of Infectious Disease and HIV Policy, and they were the ones in charge of making recommendations to Health and Human Services about Ryan White. But it wasn't just HIV. Now, my committee was HIV, but that whole office did other infectious diseases, TB, pandemic preparedness, very importantly. Just completely wiped out. A week ago Friday, they just said you're all fired and everything you do is gone.
We have a measles outbreak in Texas now, right. 2 children. And Renzo, we got the alert that we have a Riverside County case of measles.
Yep. That's another issue. And we did an episode on this before, and basically it boils down to decreased herd immunity because there's a lot of anti-vaccine movement. And it's a little worrisome that now the head of the HHS is actually one of those vaccine deniers and also an HIV causing AIDS denier, which is extremely harmful to just the general public. Okay, so when it comes to measles, like we talked about, right, herd immunity is trending down. Measles is super contagious. You're only protected 97% with 2 vaccines. And basically the 3% that's left, you basically prevent it with the herd immunity, but that's all waning now. So we're seeing these massive cases of measles. And where do we go from there? I don't know. I don't know. Like, when is it going to stop? And now there's also talk about potentially delaying like the flu strain selection that's happening that we do every year. And so that's also like in this like limbo state. So there's just a lot of moving parts here and a lot of uncertainty.
And in our community, they all affect the HIV positive, the long-term survivors of HIV who you deal with, Jeff Taylor. What is it that Robert F. Kennedy was peddling caused AIDS? Was it poppers?
Popper, yes.
Was it?
Flashback to the early 80s, right?
Yeah.
Oh
And
my God.
you can cure measles with aerosolized budesonide and azithromycin, apparently.
And was
Vitamin
it also
A.
like high doses of vitamin A or something?
Yeah.
And they're treating kids with bad liver function in Texas because they're like overloaded with vitamin A, which causes, anyway.
The one thing I know about vitamin A is you're not supposed to eat polar bear liver.
Tell
Those of us
RFK
in the
because he may
profession
pick
know.
up a polar bear part of his roadkill.
It's high in
Pantry.
vitamin A. That's the issue.
Jeff Taylor has been on the cutting edge of keeping track of things like research. We were talking about a cure. Where's research funding at now?
It's a big old question mark. So we are a subcontractor for one of the federal research groups that does HIV cure funding. It's part of the Martin Delaney Collaboratory, named after the famous San Francisco HIV activist, Martin Delaney. But they've taken a wrecking ball to the NIH. And a lot of this is a personal vendetta against Tony Fauci. So his successor was not just fired, but told that they had to go to Alaska and work for the Indian Health Service. It's like sending them into the Siberian gulag. They've done that with a number of people. They fired his wife, anything he touched. So we're very nervous that everything is going to get either slashed or eliminated altogether. There's part of the side effects of all the wrecking ball that Musk and his cohort are doing is that they're just firing people wholesale. So even programs that are continuing, they don't have the administrators there to actually send the money. So we have huge research organizations with trials all over the world that are having to stop because they haven't gotten their money yet. They're supposed to get money. They haven't been discontinued, but there's nobody there to do it. So this whole scattershot approach is just causing total chaos. And nobody knows who's going to be next in terms of the firing. They fired tens of thousands of people. I was talking today with a colleague who works for USAID, and they've shut down all their clinics worldwide. And those are the ones who are providing HIV care, and not just HIV, but tuberculosis, which is the biggest killer of people in sub-Saharan Africa.
And
malaria,
Ebola.
yeah. It goes back to the pandemic preparedness, right?
Yeah.
Now, you've known these people personally for a long time, and this is a personal question, but has it become obvious over the years in knowing many of these researchers and administrators and those who are at the forefront of the treatment and prevention of HIV, have you detected that they had a political agenda in doing this?
They tend to be on the liberal side because those are the ones who support that kind of research and care about people with HIV. But no, that's completely apolitical. So to see someone with a political agenda go in with a wrecking ball and just decimate, and people really underestimate how important research is. It underpins our whole healthcare economy. We are the world leader in developing treatments and HIV and
100%.
Yeah.
100%.
A good example is the COVID vaccine that we got in record time. That was used a vaccine platform. The mRNA vaccine platform came from HIV vaccine research. That's what it was sitting there on the shelf. They were able to take it, and gene sequencing that they were able to do so quickly. Same thing, came from HIV. Eliminate one part of research and it has a domino effect, and it diminishes everything else they're trying to do.
100%. And I come from that world, right? I did a whole PhD and we were like basically dependent on like NIH funding to basically support all that. Not just like the actual materials that we used to do it, but it also paid like our like grad student salaries, right?
Yeah.
And it is true, like a lot of the stuff that we try, like a lot of it doesn't really work, right? But like the innovation really happens from that like initial bench work that people do. And then it just basically explodes into like clinical trials and all that stuff. So
and
it's
it
crazy.
turns into a big payday for big pharma, which is
Yeah.
good for the shareholders.
Yeah. Yeah.
so
And the other thing that I'm really concerned about is, how like they're basically restructuring the HHS and they're firing all these people and they're merging all these like different like departments together. But the fear is basically that all the people that are qualified to run those departments are now basically gone. And so who's going to carry that extra, I don't know, thing that department was doing, but this other department has no idea how to continue that.
well,
It's like,
we all know what happened shortly after Trump disbanded the Pandemic Preparedness Council,
Right.
part of the NSC. And when we did have a pandemic, the response was deplorable. Now, getting back to research, Jeff's point, the NIH defunded 145 research projects designed specifically to expand access to PrEP and HIV prevention services to communities of need. That was a mere $450 million, money that would be very well spent. And doing a little research, it surprised me that during our current president's 2019 State of the Union address, he put out a pledge to eradicate HIV and AIDS in this country.
by 2030, right? Was that what it was?
Yeah, now what is he
Yeah.
doing?
Yeah.
Yeah, he's
It's
undercutting his
just-
own signature programs. It's
And
none of it
all of
makes
the
any
work
sense.
in Africa, that was really the crowning achievement of the past Bush presidency, George
Exactly.
W. Bush. He was so proud of that, and he should have been, because he changed the world.
Not to
And what's
mention
26
the
million people were kept alive by those drugs.
yeah, not to mention that all those peoples were basically subjects, right, for all the latest researches coming out of like for HIV, right? Like lenacapavir trials were done in like with women in Africa. So all that data that we're getting, so it's worth it for us to fund it so that we get all that data so that we can push forward and try to end the HIV epidemic, right? But yeah.
Yep.
Yeah, the
And-
return on investment with all this is just enormous. So it just makes no economic sense. It's supposed to be government efficiency. And as Greg was saying, prevention is always worth a pound of cure. None of
Yes.
this is going to pay off. We're going to end up paying a lot more in money as well as lives and health lost.
Okay, PrEP is very expensive. Is that going to go away as, I just want to say, as a prophylactic treatment?
It's going to be up to the Supreme Court, actually. So in 2022, a Texas federal judge basically decreed that some employers, okay, did not have to follow the ACA ruling mandating 100% insurance coverage for HIV prevention. And the rationale behind that was basically that because the majority of people that use PrEP are homosexuals, that these employers, their beliefs are basically anti that behavior. And so it basically violates their rights under the Religious Freedom Restoration Act.
We're not talking
so-
about baking gay cakes here. We're talking about
Right, but-
keeping people alive.
Exactly, but that's where we're at. So basically that whole thing's going to go to the Supreme Court and they're going to be hearing like oral arguments starting like sometime in April, and the decision should be made by like late June, early July. And that has like tremendous repercussions of what's going to happen, because if we lose PrEP funding, I guess some people will be able to afford it if their insurance covers it. But what's going to happen to all the people who rely on things like Medicare or Medi-Cal to cover these things, or Medicaid? You know what's going to happen? Like, we're going to see a huge spike in HIV infections and potentially a loss of access to treatment as well. So those are things that really matter, right? Those are things that people are afraid about.
And in a population that doesn't have insurance in a lot of cases and will be at
Yes.
the emergency room, and it's going to have to get paid for. Should we be thankful that we live in California? Is
Yeah.
there any, why? Tell me, I'm looking for happiness.
A lot of the treatment is funded by the Ryan White Care Act.
Mhm.
And that includes and this is the question I get every time I go up. People come up to me and say, "Oh my God, what's going to happen to Ryan White?" Because they're the payer of last resort. So people who don't, the people you were talking about who don't otherwise have coverage, the undocumented, those folks, all are covered under Ryan White. And then additionally, the cost of the drugs, you're talking about how expensive they are. Part of that is the AIDS Drug Assistance Program. So in California, if you make less than $65,000 a year, it will cover your HIV drugs and a whole host of other drugs for HIV-related conditions 100%. So that's a huge security blanket that could get ripped away. Now, but the bright spot for California is that California has always moved to expand that formulary. Every new drug that comes out, they put it on immediately so people get access to new drugs if they have resistance, for example, and for related conditions. So California has pledged to pick up the slack. So if there are cuts in that, they're going to make sure that people in California still get completely covered. And so we hope that that will be the case.
Greg, I'm going to let you give us some glimmer of light through the tunnel of darkness, and please don't make it an oncoming train.
No, actually, PS test is still going strong. We are still doing totally free STI testing, treatment, and prevention services. The appointments are easy. We offer same-day appointments most days. We do not encourage walk-ins, but we do take walk-ins. We've expanded our hours back to our original hours from before we had that little issue with some funding. The community has rallied, and I think that's important for the community to know, that these services that we're providing benefit everybody in this community, in some way, shape, or form. And whether you're sexually active with multiple partners or know somebody who's sexually active with multiple partners, or just dip your toe in the water occasionally, we're there for you. And by reducing its herd immunity, by reducing the incidence of STIs in the entire community, we can dramatically reduce the spread. So everybody who's listening, if you have charities that you donate to, consider donating some money to help the effort that we are talking about today.
And there is something coming up that HARP-PS is putting together, is the Self-Advocacy Conference, Jeff. And this is for anybody in the community. You've opened it up. And can you tell us a little about the who, what, where, when?
Sure. So it's not just about HIV, it's about anybody dealing with the healthcare system. So that's most of us, especially as we get older, right? And so that's going to be a week from Saturday on April 19th from 9 to 3 at the Mizell Senior Center. And you can go to our website, harp-ps.org, and sign up. It's totally free. We feed you lunch. There's a little bit of breakfast beforehand. We've got a lot of great speakers talking about lots of issues like nurses and how to talk to your doctor, legal issues that you might need to encounter, all sorts of things. So first time out we've done this. We've got a great roster of speakers, and we're really looking forward to sharing this with the community.
And you have a checklist of what kind of documentation should you have every time you talk to your doctor? Because I know, Renzo, you've been asking your patients to did you get a shot? Did you get this? Right?
You have no idea. The patients that I love the most are the ones that come with, they make a little CV, like a little resume of like their stuff. It's like basically all the medications I'm on, my medical conditions, and like my past surgery condition. And you have no idea. I just look at it and I'm like, oh my God,
love you.
Hug you. I could hug you right now. Cause it's like, what I hate is when people say to me, I take that little white pill. I'm like, what does that mean?
All I know is the little blue pill. That's for another
More like
show.
a long, exactly.
All right, I got to thank you, both doctors and our HIV positive and aging project Palm Springs expert, Jeff Taylor. You've been in the trenches for decades. You've been HIV positive now, or what are we, 45 years?
44, yeah.
Oh, man.
B?
Okay.
That's amazing.
I want to mention something about that. Okay. I feel like this fight was fought, right? 80s, 90s. And I think a lot of us took it for granted. And when we go to these protests or we rally together, I wish we saw more people in their 20s and 30s that are actively showing up to these things, because being apathetic about these things is not going to make it any better for anybody. So if I have any kind of message to say, I just want like the younger people to be a little bit more involved in what's going on.
Yeah, they weren't there. They don't realize it's not their fault. We fought that fight so they didn't have
Exactly.
to think about
But
it.
the fight's still going. It's not something that we just sleep on.
And
So-
some of us old geezers have muscular memory. We know how to protest and carry a sign.
And that might be it. A lot of us don't. I'm like, what do I do? What do I say? But you just show up to support people. I don't know. It's just, that's my own
Well,
thing.
I think courage is contagious.
No, yeah.
And if you get up and out and show up and show out with people that are courageous and have been there and have fought the fight and know that it can be won, it does, it gives you power. It gives you
Yeah.
power.
And I
It's
hear really
different this
sad
time
things from
around.
my patients. My patients say things like, I thought I fought this fight. I thought it was done, and it's just such a hard thing to hear. And it's just so sad.
Jeff Taylor, since you have the beard of Methuselah and the most experience, I'll give you the last word.
I think, as you were saying, we've been here before, right? We've seen this. What's different this time around, though, before it was just people with HIV. We were isolated minority being ignored and killed by neglect. This time they're coming after everybody. They're huge. So there's power in numbers. It's time to start getting out of our little silos, identity politics, and unite with everybody because we're all affected by this. Our democracy itself is at stake. So I think there's a lot, but power in numbers. We can do a lot if we unite. Use that muscular memory you were talking about and get out there and fight together. That's the only
Let's
way
make
we
it a
can
big tent.
Exactly.
And for anybody who has a specific question for Dr. Renzo Corzano, we always have the email that's up and ready for answers. It is lgbtqhealth@mydohc.com. Thank you all for being on Ask a Gay Doc, and you made me feel a little bit better. Although I still do feel like I'm like leaning back on a chair and I'm just about to fall. I think that's how everybody's feeling at all times now.
Yeah, man.
John, I want to thank you for being such a wonderful voice of the community.
Oh, I'm just
Yes.
a megaphone for y'all.
We need staunch advocates like you. Thank you.
You do.
Yes.
Hey, it's John Taylor. Thanks for watching our video. And don't forget to like and subscribe to our KGAY channel so you won't miss anything going on in the gayborhood. And you can always listen live to KGAYPalmSprings.com.